Hello, welcome to Body Capsule. We are going to talk about cold injuries. What is cold? At a low temperature, especially when compared to temperature of human body, not warm or not hot. It damages to the body from cold exposure, including hypothermia and several skin injuries. Cold-related skin injuries are categorized into freezing and non-freezing cold injuries. Freezing cold injuries involve tissue damage when exposed to temperature below freezing, such as less than 0 degrees Celsius. What happens to the body if it is exposed to cold environment? When the body is exposed to cold environment, it activates sympathetic nervous system with cutaneous vasoconstriction, which leads to shivering and involuntary contraction and relaxation of muscles. If core body temperature falls at 29 degrees Celsius to 31 degrees Celsius, it fails shivering. What are the forms of cold when it gets exposed or varieties of cold exposure? Cold exposure leads to 1. Chilblains, 2. Trench foot, 3. Frostbite, 4. Hypothermia. Before going into topic, let's discuss some physiological effects. Physiological effects of cold most commonly noted are metabolism, fluids and electrolytes, respiratory, cardiovascular, hematological, neurological. Metabolism, blood is reduced, kidney shows drastic changes. In stress, it activates gluconeogenesis and glucogenolysis, with decrease in insulin efficacy leads to hyperglycemia. Fluids and electrolytes. Body cools, there is decrease in plasma volume as fluid moves intracellularly with following inadequate tissue perfusion. There is a decrease in intracellular potassium when body core temperature drops at 25 degrees Celsius, or if potassium decreases, it may lead to cardiac arrhythmias. Respiratory. For every 1 degree Celsius reduction in body core temperature, it drops 6% oxygen consumption. Cardiovascular. Due to cold exposure, there is reduction in cardiac output. Around 28 degrees Celsius, heart rate decreases by 50%, which may fall into risks of cardiac arrhythmias. We come to question asking about why handling of a hypothermic person needs to be performed with great care. It's because excessive stimulation of movement may aggravate progression to ventricular tachycardia. Hematological during cold exposure. There is increased plasma viscosity if body core temperature reaches at 25 degrees Celsius. Enzymatic reactions occur such as coagulation cascade prolonged, platelet trapped in liver and spleen which results bleeding. Neurological. In brain, cold exposure causes decline in cognitive function at around 28 to 30 degrees Celsius. Absence of brain electrical activity is seen below 20 degrees Celsius. It is considered to be neuroprotective as it stabilizes blood-brain barrier and cerebral cell membrane.